Welcome back to Gentle Giant Q&A. So here we're talking about something that people have so many questions. It's called the period shot, also known as the P shot, but I call it a power shot because once you get it, you will have some power. So what is the power shots and how does it work? I get a question about that all the time on Instagram, so I want to explain what it is. So a lot of people have different issues, whether it's erectile dysfunction, which is a lack of blood flow to the penis. Also, someone can have what's called Peyronie's disease, which is scar tissue development in the penis that can cause it to have a curvature. So that can be caused by trauma or some type of, somebody has a comorbidity or something like that, like diabetes or something like that. But also too, erectile dysfunction also can be caused by things like high cholesterol, where you have plaque in the veins that supply blood to the penis. But also, some people get it just because they want a better erection, more blood flow to the area, and also just to have better sensation and also better orgasms as well. Okay, how does it work? There's two different ways that we can do it. One way is we're using platelet-rich plasma, which is what we use from the patient. We draw their blood, we spin it, we take that plasma, and then we inject it back into the area in 5 different injections. Another one we can use is stem cells, okay? The difference between your own PRP and stem cells is the stem cells is coming from the placental tissue. We're using that Wharton's jelly to go in there and do the same thing as that PRP. However, the stem cell product is far more potent than your own PRP. So if you have someone who is not healthy, overweight, diabetes, these types of things, their PRP isn't gonna be as potent as someone who's really healthy. So if you have someone who wants the shots but is not healthy, then their best bet is going to be more benefited by using the stem cell product. Okay, where exactly is it injected? It's injected in 5 different areas. It's going to be in the intracavernosum at 10 o'clock, 2 o'clock on the sides of the penis, as well as the glands of the penis as well. I know y'all think it hurts. It's not, which leads into my next question. Is it painful? It's not, because we do what's called a pudendal nerve block, which means you could be chilling on your phone on Instagram and you won't feel a thing. The procedure takes literally about 3 to 5 minutes. But also, after I get done doing a procedure, I like to use red light therapy because it can also increase blood flow, take away inflammation. I like to send patients home with that as well because you want as much blood flow as possible, especially if you're trying to heal the scar tissue that's been done by Peyronie's disease. How soon can I notice results? You can see results within 3 to 5 days, but you also can have sex right after. It does not hinder you from doing that. But also, if someone is using stem cells, it does take a little bit longer to get those results, but it does work really, really well. I have seen patients see results for 2 to 3 years with the stem cells and maybe 6 months to a year with the PRP, depending on how healthy they are. So that's very, very important that you're hydrated, especially if you're going to be using your own PRP.